Hello, this is Dr. Nabih Mukhtar, Senior Clinical Fellow Critical Care Medicine, UK. And in this video, we are going to talk about some facts regarding blood culture. Fact number 1, contamination. The microorganisms could be introduced into the blood culture bottles from the inadequate prepared skin. This can lead to positive blood culture results, whether the patient truly has a bloodstream infection or not. And you need to suspect this if a single random culture of Bacillus species, or much more commonly, the coagulase negative staphylococci, are grown. And the best way to avoid this is to use the aseptic non-touch technique and to disinfect the skin appropriately prior to drawing blood culture samples. Fact number 2, indications. Blood cultures are indicated if the patient has signs and symptoms of infection and sepsis, like core temperature less than 35 degrees or more than 38 degrees, or the patient develops a tachycardia, tachypnea, hypotension, or has raised or very low white blood cells. And all of these whether the patient has focal signs of infection or has a pyrexia of unknown origin, or if the patient more obviously has a septic shock. Fact number 3, when. We need to know some practical tips about when to take blood cultures. So first of all, blood cultures needs to be taken before starting any antibiotics. And if the patient is already on antibiotics, we need to take blood cultures immediately prior to the next dose of antibiotics or when the patient spikes temperature. This is one thing. The other thing is that if other blood tests need to be collected at the same time as the blood culture, always take the blood culture first. Fact number 4, how many? To achieve the greatest chance of detecting bacteremia, it is recommended that 2 paired sets of blood cultures are taken an hour apart from 2 separate sites. But bear in mind that for patients with acute infective endocarditis, you need to take 3 blood cultures from 3 separate vein punctures in the first 1 to 2 hours of evaluation, then therapy begun. Fact number 5, where from? Always take blood cultures from a peripheral vein before taking any other blood tests, and that's commonly from veins from anterior cubital fossa or the back of the hand. Fact number 6, where not to take. You need to know that it is not recommended to take blood culture from a peripheral cannula. However, if the blood culture can't be taken from a fresh vein puncture site, it can be taken from a peripheral cannula only if it was put under aseptic technique and only at the same time of insertion of the cannula and not thereafter. This is number 1. The second site you need to avoid is the femoral vein puncture because it's difficult to get an adequate skin cleaning and disinfection. Also, you need to know that blood cultures can't be taken from the vascular access device, like a central line, unless it is suspected to be the source of infection, and in any case, a peripheral blood culture should also be taken. Fact number 7, blood culture bottles. You need to know that blood culture bottles should be kept at room temperature and sent to the lab within 2 hours, and it is not recommended to be kept in the room temperature longer than 4 hours. Thank you and hope you enjoyed the video.